The following podcast is presented for informational and/or entertainment purposes only, with no intent of determining a psychological diagnosis or as a substitute for treatment. If you or anyone you know is struggling with mental health and/or substance abuse issues, call the SAMHSA National Helpline, 1-800-662-HELP, 1-800-662-4357. Learn more from the Substance Abuse and Mental Health Services Administration online at www.samhsa.gov. Engaging Minds is brought to you by Daranaut Health, addiction coaching and private in-home rehabilitation. Your life, your home, your recovery. DaranautHealth.com.
Hey, this is Dr. G, and welcome to Engaging Minds, where we like to look at our world from a deeper, more psychological point of view. Today, I really want to focus on the psychology of the mind-body connection. And the person who's going to help me do that is a friend of mine. His name is Dr. David Schechter. He is a mind-body specialist. He's also a sports and internist doctor and the author of two amazing books. One is called the Mind-Body Workbook, and the other is Think Away Your Pain. Dr. Schechter, it's a pleasure to have you on.
Thank you very much, Dr. G.
Well, you know, Dr. Schechter, one of the things I wanted to talk to you about is an experience I had this morning. So I'm dealing with a patient. He's got tremendous hip pain, and he's taking all these painkillers. And I thought, you know, what about helping him deal with the psychology behind his pain, the psychology behind pain management? And here's what I found, and I find this with a lot of patients. For some reason, he was completely resistant. He said, no, Dr. G, I'm taking care of that with my pain management doctor. This is not a psychological issue. I don't even want to go there. And you know me, so I just kept wanting to dig a little deeper and deeper, and the walls just came up. And I've had that experience with several people. So I was wondering what your experience was when there seems to be, for some reason, so much resistance to dealing with the pain management side, and at the psychology of the pain management side.
So I have a few thoughts on that. One is that when people have failed everything else, they suddenly become more open to looking at the psychological or the mind-body side. So sometimes we unfortunately have to wait until they've tried other things that haven't been successful.
You see, he has some success with medication, but he has to keep increasing his medication.
You know, another thing I point out to patients is that there's a difference between acute pain and chronic pain. And I try to explain it to them from a neuroscience perspective. There's imaging, functional MRI imaging of the brain that shows that acute pain is experienced in one part of the brain, but that chronic pain is experienced more in the parts of the brain that connect to the emotional centers. So it makes much more sense to apply psychology to chronic pain than it does, for example, to acute pain, like a sprained ankle or a broken toe. So that's
would you say
people.
That's really interesting, because I was thinking that acute pain, and you say it's more connected. I mean, chronic pain is more connected to the psychology of the person, which could be the reason why somebody might be in therapy, especially in long-term therapy. If there's trauma, if there's a chronic issue that the patient might be dealing with, like depression or anxiety. So I wonder, do you see a connection to that there's certain psychological conditions that seem to be connected more to chronic pain?
Yeah, with the patients I see with chronic pain, I look at two aspects. One is personality type. So I'm looking for something that we call the type T personality, with this T for tension. These are people who are very hard on themselves, highly responsible for others, perfectionists, people pleasers. I'm looking for personality type. I'm definitely asking about childhood. I'm looking for both big T and little t traumas from childhood and adolescence, and also just people who are under current stress. So I do definitely find that with chronic pain, as I start opening them up by asking questions, which they're not expecting to hear from a physician, more likely hear from a psychologist like yourself, It does seem to help them begin to look at this aspect.
So once you get them to open up and begin to look at this aspect, what are the next steps that are involved?
Well, education is a key element. That's why I recommend they read one of the books, such as my book. My
Absolutely.
mentor, John Sarno, used to say education is the penicillin for chronic pain. And so obviously his books are also a resource. I start with education. There's now a lot of videos. I link them on my website, and I also will hand patients a resource list. There's videos they can watch. There's apps they can look at. Education's a key element. Step 2 is journaling. So not everyone can see a psychotherapist 7 days a week, but you could certainly spend 10 or 15 minutes writing in a journal. And it's a very effective tool. There's a lot of medical research actually on journaling, and it augments what they might be doing once a week typically, or sometimes twice with their psychologist. So we use a lot of journaling. And the third thing is reducing fear and trying to get them to be active again. I just spoke to a woman the other day who said that her physical therapist and her chiropractor said, don't lift this, don't bike, don't do that. I said, what are they allowing you to do? She said, really almost nothing.
Just
and
sit
I said,
down,
that's
which is
not
the
the
worst thing to do.
right. I said, that's not the way you get out of chronic pain. You have to start moving. Now, I'm not telling you to run a marathon tomorrow, but how about we start with 7 minutes of walking or 8 minutes of biking and add a minute every other day? And so getting them out of the fear cycle.
I think that's so important. I want to add something to it. I think it's such a reflection of our society because, like with this patient, he's so used to taking a pill or getting a shot because that's how we're conditioned to deal with things. We just want instant relief. That he was really hesitant to hear that his pain could be part of a process, like part of a process of dealing with fear. And perhaps if he adds that to his regimen, as we talked about, the mind-body connection, he may get some relief more naturally. But this is what I wanted to say to him, Dr. Schechter. That's going to take some work. It's going to take some commitment. It's going to take, for him, thinking outside the box. And that's what I find is so difficult for people because we're so conditioned in our society to just take a pill for an ailment. And also on some level, I'm going to add to this, there seems to be more trust in the physician than there was in the psychologist.
Healing often starts when the patient is willing to commit to doing things rather than just being a passive participant in the process. And so doing things like I mentioned, reading, watching a video, journaling, going for a walk. I mean, these take them out of the role of being a victim and out of the role of being a passive participant to a more active participant, which I find is a key element in the healing process. But you're right, there's a lot of people who just prefer the simplicity of, I'll take a medication for it. But then you can also explain to them that a lot of these medications might be safe for a few weeks or a month. I'm talking about
there's
opioids.
the addictive quality to them.
Yeah, the opioids and that type of thing. But when you're getting into longer term use, there's a lot of side effects, hormonal changes, and other things that we've learned about. So there was a period of time where everyone was getting opioids. Now, of course, we've almost flipped in the opposite direction.
Right.
But, medication has its role, but it shouldn't be the only thing that people do. An integrative biopsychosocial.
Yeah, I know. That's what I want. You're right, 100%. That's what I wanted to point out to our audience is that what we both believe in is this mind-body connection. And that doesn't mean that medication cannot be part of it. It definitely can. And that's why you want a trusted physician like yourself to be able to take care of, that aspect of it, but also looking at your mindset. Like you said, your psychology, your personality type, how that all contributes to it. I actually want to expand it too, to look at your family history. How does your family tend to deal with pain? Coming from a Jewish family, I have to say that a lot of times pain was a badge of honor because that's how you got a lot of attention. That's how, that's, the old world word, you fetched a lot. So
yeah, attention is something that in some families, children get not for just being there or not just, they get it when they complain or they get it when they have pain.
Exactly.
And so that can reinforce a cycle of pain as something that gets you attention, gets you love, etc. But, when we were talking about medication, I think about my patients with migraine headaches, which is another area that I deal with.
Sure.
And I don't take them off their medication for migraines right away, but I find that if we work on the psychology, we work on the mind body, that very often they can start reducing the amount of medication they take and sometimes getting off it completely. So they have to be open to it. Sometimes I call it planting a seed. You tell them this concept that, psychology is important in pain. They may not listen to it the first time, but you hope that they'll come back to it perhaps in a few weeks or another visit.
That's so important for people to remember too, because I know that as a psychologist, so many times you plant a seed and it could take a year later, someone could come to you and say, hey, Dr. G, I was thinking about so-and-so, and I came up with this brilliant idea, and I'm thinking to myself, well, I suggested that about a year ago, but hey, you got there and I'm really happy about it.
I've had a lot of patients who got as a Christmas gift or a birthday gift, they got my book or one of my mentors' books, and they looked at it and said, rejected it, put it on the shelf, forget about it. But then they pick it up 6 months or 8 months later, and suddenly it becomes extremely relevant to them. Exactly. So there's that readiness for change, which is talked about a lot in the psychological literature, that sometimes is necessary. But the second time around, after they are interested and pick up the book, they'll call for an appointment.
So you've mentioned a couple of times about your book. Tell us a little bit more about your two books.
Well, the first book that I wrote was the Mind-Body Workbook, which was to try to create a systematic guided journal. So journaling is writing about your feelings for 10 or 15 minutes a day, but it can be hard to just do that with a blank notebook in front of you. So the Mind-Body Workbook gives you guidance, gives you questions every day, prompts to answer, and makes it a more feasible process. I'm excited to announce that next week, the Mind-Body Workbook Volume 2 will be coming out.
Oh, wow, that's fantastic.
A long-awaited new edition, but it'll be, you can do in either order. You could start with the original Mind-Body Workbook and do the new one, Volume 2, or you could do it the other order. Think Away Your Pain goes into a lot of detail about the psychology and the neuroscience on a lay level of chronic pain, and really discusses treatment, discusses what I call the 12 stages of healing, discusses the 7 key elements of pain. We won't have the time to discuss all of these today,
sure,
but it gives patients really a chance to understand this. I think it's very user-friendly and clear, and I've gotten good feedback on both of these, which have been out there now for a little while.
No, I think that's fascinating. Congratulations on the second edition.
Thank you.
It's making me think about the relationship between psychology and how we have different techniques in dealing with pain, like cognitive behavioral therapy, biofeedback. But I also believe that the unconscious is very powerful when it comes to pain. So implementing psychodynamic theories of a way of dealing with the unconscious. I've seen this so many times in my practice too. Sometimes people will hold on to their pain because it's something concrete to hold on to, and it's something that they, for somehow, can understand. They can understand it, Dr. Schechter.
I had a patient once said to me that in a video, actually, that I recorded, that pain had become like a friend.
Exactly.
Now, obviously not a friend that you would like to take out to dinner, but there was a relationship that had developed, and it's an unfortunate thing that you have to break away from. We talked earlier about some of the ways you can break away from that pattern, but you get used to it in a kind of a horrible way, but
you see that a lot in addiction. It's the same thing. It becomes your best friend. And there is this sense of abandonment and the sense of loss and letting go of the pain. So I agree with that completely.
Pain and addiction have some definite similarities and obviously some differences as well, but I definitely see that.
Well, quickly, what do you see as some of the differences?
Some of the differences are that, unfortunately, there's a higher rate of, I guess, death and suicide with people with addiction than there is with chronic pain.
Right.
And there's probably more
people with chronic pain are so highly addicted to opiates that they end up with both chronic pain.
Sometimes there's an overlap, and that's we that's one of the reasons we had spoken recently about the fact that chronic pain can lead to opioid prescribing, which can then lead to addiction either to opioids or sometimes to other things like heroin and fentanyl, which are even more horrific. I would say that addiction treatment generally responds well to very structured programs and sometimes to inpatient structure or a home program like you're developing as well. Whereas chronic pain in general, we can work with people effectively as an outpatient. In both cases, groups can be helpful. It seems like having a sponsor or a mentor is even more valuable in addiction than it is in chronic pain. So there's some similarities and some differences. the 12 stages of healing that I came up with are a little, I used the 12, but it's not exactly, I don't follow exactly the addiction list.
Right. And I like what you said, that it seems like what people really need more than anything to help them let go of some of the addiction, or to evaluate how they're dealing with medication as far as treating their pain, is a sense of structure. Because that will help a lot with the sense of loss, that if people feel like they have something to go to that feels solid, they may be more willing to let go of, some of their preconceived notions or some of their addictive patterns when it comes to medication, and also when it comes to how they deal with pain. But I wanted to say this, that I found that, pain is something that's concrete. People can measure it. You can almost see it. But when you're dealing with the unconscious, you can't do that. You can't really see it. And it gets into those areas of feelings and emotions, which a lot of people have a hard time with. So they're much more comfortable in saying, I have a pain in my back, versus saying, this stress in my life and this argument that I had with my spouse is causing this pain to get exacerbated. And it's making me feel weak, or it's making me feel inept. Those kind of complexities are much more difficult for people, I find, a lot of times to deal with, than just taking, a pill.
Yeah, well, it's a societal limitation. I'd love to get into the schools and begin the process of educating the next generation. They call it social emotional learning. Try to make the young people more aware of the mind-body connection and how your feelings can affect both your physical and your mental health. See, that's the key. Feelings don't just affect your mental health; they also can affect your physical health. And so, it's really important to understand them, express them, and to work with them. And obviously,
so
therapy.
That's a great point you bring up, Dr. Schechter. If you were dealing with an adolescent, a younger person, a kid even, who has chronic pain, how might the approach be a little bit different when talking about the mind-body connection than when you're dealing with an adult?
Well, I work with some adolescents with chronic pain. Children hasn't been a specialty of mine. I mean,
Right.
Adolescents get to the point where they can do more abstract thinking. So you can present concepts in a more sophisticated way once someone has typically gone through or is in adolescence. Whereas there are people who specialize in childhood pain, and it's not a specialty of mine, but it's more difficult because you're trying to access, like a child psychologist, you're trying to access
Sure.
feelings sometimes with drawings and games and other things, because the ability to express the words abstractly is not yet there. But people of all ages are dealing with difficult things in their life and trauma and stress, and we just need to kind of be more open to it in our society and talk about it and journal about it. I think things are starting to change in that area.
I think things are starting to change too. I think coming out of COVID has taught us a lot around, how the mind body is all connected.
Mm.
And this used to be more of a thought that was, let's say, just not as mainstream as it's becoming today. I do want to add one anecdotal, very quick story before we end. I had a patient for a long time who was dealing with pain. And when I got into the psychology of it and really started to try to understand his resistance, what he said to me was, well, my mother, he was Jewish, and I can say that, said, my mother always, I started to tell you the story, she always complained and kvetched and all that. But, that was the way I bonded with her. That was the way I connected with her, through our pain, through our physical pain. So I felt like letting go of some of that physical pain would ultimately, disconnect me from my experience with my mother, and she may actually start to resent me for it. And I thought, culturally, even though I joke about it, I thought that was such an interesting insight that he made. And once we were able to find that connection, he was much more open. And then we talked about ways that he could actually help his mother in the process too.
That's a great example of, how the family of origin is so important, and how understanding some of the deeper roots of our pain psychodynamically can take us forward. For some people, just the education's enough. For some people, lighter degrees of emotional work like journaling is enough. And for other people, the deeper psychological work is important. So obviously, individualizing treatment is part of what we do to find the right approach out of pain for patients.
And you know what? I'd like to believe, whether I'm being altruistic or not, this can also help us out of the pain that we sometimes experience in our society. That if we heal ourselves, we might be able to, heal some of those social issues, even issues like, racism and cultural issues that we deal with. So, Dr. Schechter, if people wanted to find out more about you or how to get in touch with you, how could they do so?
Well, my website, mindbodymedicine.com, is really the best way to find out more about the things we've discussed on the program today, and also links to my books and my office and contact information. Mindbodymedicine.com would be the best way. I'm in Culver City, which is Los Angeles, California. You can also look me up there. And I appreciate people taking the time to listen, and thanks for having me on your program.
Dr. Schechter, it was a pleasure to have you on, and congratulations again about your new volume, your new workbook. It sounds very exciting. I'm Dr. G, and we'll be back next time with some more enlightening and wonderful conversations that will help us dig deeper into the world that we're living in.
If you or anyone you know is struggling with mental health and/or substance abuse issues, call the SAMHSA National Helpline, 1-800-662-HELP, 1-800-662-4357. Learn more from the Substance Abuse and Mental Health Services Administration online at www.samhsa.gov.